pain, and they are having pain with loaded knee flexion. Your exercise choice to begin with, we want not knee flexion exercises, okay? So avoid knee flexion early in your exercise choice. They can do a lot, but if you put them in a loaded position, their muscles are going to switch off if they're in knee flexion, because I've already told you that's going to hurt. So we can do your rear foot elevated RDL. Now, I would like you to try, and we won't necessarily do this today, I would like you to try crab walk progressions from the knee to the ankle to where Josh has it on his feet. Okay, so basically it's on the base of your fifth metatarsal there. So self-experiment, but it increases the load in your glutes quite a lot. Both the lever from the hip to the band, but also it now pulls your feet in together. You have to actively externally rotate. So I use it for perineal tendinopathy as well. I use it for lateral ankle stability because it makes them have to activate their lateral stabilizers. It's a really good exercise. And then you've got sled push. Now he's actually doing that single leg on purpose. He's recovering from a hamstring strain. But just to show you again, you can do some good exercise, some nice strong exercise, but avoid loaded knee flexion. Okay, exercises for hip and knee control. We're going to have a go at two of these, all right? So the first one, oh, see, that's throwing me. I thought the first one was the first one. The first one's the third one. This I call an aeroplane. I'm not sure if that's what it's called, but that's what I call it. Pardon?
CARS.
Ah. Is it? So it is an arabesque or a single leg RDL. Hip external rotation, so deep hip external rotators working. Whoop. Down, knee drive up. So you're going to have a practice of that one in a minute. Lunge to stand and hold. So if you've got someone where you're working on stability, and this fellow, he's had a meniscal injury, I want him to have nice stability through his knee joint. I want really good control. Bridge, hold. Now lift the leg, extend out, bring it back in, foot down, reset the hips, opposite leg lift, hold, extend out, and down. And a side step up here, you're maintaining the load on the step leg the whole time. So the idea is that you're keeping that lateral stability. You come down and tap here and tap up. So we're doing it, see how his foot's on the front half of the step and then he's tapping at the back half of the step. So it ends up being a movement sort of back like that instead of a knee forward. So while we're getting some knee flexion, it is knee flexion this way instead of a step down, which is knee flexion that way. Does that make sense? Okay, everybody stand up. See it again. The standing leg. The one on the step. Okay, so make sure you've got a little bit of room to wobble. So I want you to first do a lunge. And then I want you to stand up, knee drive, hold. And hold. When you've got your balance, you have license to go back down into your lunge. Stand up, hold. And down. Stand up, hold. Your standing leg has got to stay stable, so we don't want any rotation underneath that patellofemoral joint. Down, and up, hold. Good. Okay, swap legs. Now you're going to do your aeroplane. So, have enough room. Tip forward until your back is horizontal. Tip up so that your non-standing leg, hip and shoulder rotate up. Rotate down to neutral, back up, knee up. Okay, tip, 90s, rotate up so you're pushing through your standing leg. Make those standing leg glutes work really hard. Rotate down, stand, knee up. So it's a rotation from your shoulder and hip over your standing leg glute. You should feel it right there. Deep hip external rotators. Great work, great stability. Really good work from that control perspective. No load of knee flexion. So great exercises for patellofemoral pain. For strength and for that control aspect. And then introduce exercises that start that kinetic chain loading. So, again, I'm not sure. So, anterior kinetic chain, working on that stability through the pelvis and hip flexors, walking lunges, skipping. So, if you're going to go towards running, so see her knee. That's a terrible example. Look at those knees. Yeah. So, she was so excited to get back to skipping, but cueing her, which I showed her because I had a mirror in front of her, do not let those knees come together. And then we want it to all come together. So in the end, you're starting to look at how are you going to make this all look like a usual sort of physiotherapy program. Your exercises need to be effective in the long term. So you're going to be getting them to do weight, strength-focused exercises. Now I'm talking all knee conditions here now. I'm not sticking with, we're not following on for patellofemoral. This is just blanket everything. Strength focus. You're going to have specific strength focus that you're going to work on and maintain. You want to work on their individual impairments, so if they have a lack of mobility, there is always going to be a mobility focus within their exercise. You might have a couple of exercises that you target at the start of their gym program, or at the end if you find that more effective once they've warmed up, to begin to get them moving into those directions and maintaining. A little bit often, it's not aggressive, it's just you want to keep them moving and maintain those gains. It's not to take your foot off the pedal because then they stiffen up again. Stability control. You might use them as activation exercises at the start of their training or activation exercises at the start of their gym. So they work on things like doing that aeroplane exercise or that lunge to stand or other sport-specific movements, hopping 90-degree turn, that give them the feedback to the muscles to begin to stimulate those neuromuscular pathways before they go into sport-specific function and training. So you're coordinating all three of those. Add those elements. You want speed and power. You want speed through range of movement. Multi-joint integration. They don't have to be isolated anymore. They're going to be much more compound exercises. Plyometrics are important. If they want plyometric function, you need to have plyometric exercise. However, remembering you can't do plyometrics every day of the week. So if you're going to do plyometrics, you need a rest day. How you integrated that into their training. They do a training day and a weights day. So training meaning running around, and a weights day strength. You can't integrate plyometrics into their weights day because then they're doing plyometric work every single day, and that can blow up their tendons. We want that 48-hour recovery for their tendons. Dynamic balance, which we've been through exercises and options for that. Plyometric exercise, think about that vertical and horizontal components. Landing response and stability. And progressive loading of function. Maintain that strength. It's ongoing. This is not a job that just finishes and they don't have to do it anymore. They have to keep going with this. The goals and the outcomes depend on the person that's in front of you. Not everybody wants to be a runner. Not everybody cares about doing exercise to progress to running. It needs to be meaningful to the person in front of them. Education regarding what is their ongoing management. What are they going to do if their knee starts getting sore? What should they do if they've had a break from holiday? How do they on holiday, or they just lose interest? How do they restart their program? And what should they do? When should they come back to physio? And really clearly define from the start what is 100% better to them, and give them a plan to get there. Thank you.